We know that half the people in the country don't see the dentist every year. Our goal is really, how do we make that process a lot easier and more efficient and effective?
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster with Brant Herman, CEO and founder of MouthWatch, creator of Dentistry.One, right?
Yeah.
All right, Brant, good to see you.
Same here.
You are a category leader in teledentistry. It's a fascinating field. I think a lot of people think about dentistry needing to be completely hands-on from beginning to end. So how can there be a virtual component to any of it? And yet you have proven that that is both possible and incredibly useful. So tell us about it.
Yeah, I think we still need to get people into a dental chair for a ton of services. Our goal is really, how do we make that process a lot easier and more efficient and effective? We know that half the people in the country don't see the dentist every year. So we look to be a tool for engagement and outreach, getting more people in a very comfortable setting to talk to a dentist, understand the need for treatment, what there might be a concern with, and then we do care coordination to get them into an office when they do need treatment, be it preventive or restorative.
So you're saying I can't get my wisdom teeth out over a Zoom call?
We're not doing that yet.
So you started with MouthWatch, you launched Dentistry.One. What's the difference? What was the reasoning there?
So we learned from MouthWatch and a platform we created called Teledent, which allowed practices to deploy teledentistry, that sometimes the biggest obstacle was actually just the structure of time to get a provider in a practice to step away for a teledentistry consult. Didn't make a lot of economic sense because they were busy with a patient and seeing a higher value restorative case. So with Dentistry.One, our goal was we had to actually become the entity that could deliver care. So we formed a dentistry support organization, a dental support organization, which is Dentistry.One, and then we create PCs around the country, professional corporations, for dentists to deliver care no matter what state a member is in.
Okay. And how big has that gotten?
So we have a nationwide network of doctors now, and then we've built our own platform for the delivery of virtual first care. We do more than just the dental consultation with the dentist. We actually have oral health coaches who can focus on a systemic health concern. So if you're pregnant, if you're diabetic, if you have a heart issue, we can coach you on all of the things that help improve your outcome on the medical side before you even have to get into a dental office.
Something you and I always talk about in our interviews is that it's not just dentistry. Oral health is an on-ramp to holistic health. Help educate us on why that is.
Yeah, I think the research is now no longer cutting edge. I think it's well established. We know that diabetic patients, when you look at inflammation, so much of that's indicated in the oral cavity. And if you can address inflammation in the oral cavity, you're halfway there on reducing inflammation. So it's been an interesting transition over the years to see more of a conversation about chronic inflammation is what you're addressing, not gum disease.
Yeah.
So we're trying to find these ways of increase that education. And an interesting part is siloed dental and medical is just the way it's been. We see that you need a digital bridge to start that journey of really helping a patient from a medical side know that your outcomes are going to improve if you get proper dental care. So we try to be that route to get them into a consult and then them into treatment.
So just to make it super practical, let's say that I'm a patient in a rural area and I have low access to a dentist or even primary care, but maybe through a teledentistry program, I'm able to have somebody stick an oral camera in my mouth and I'm able to beam that to a dentist who then starts to see the signs of a chronic disease that's developing more than just your teeth and gum health. They see something else that then starts a conversation about more of my health.
I would say, so for us more, it's let's start with their smartphone.
Okay.
So we would start that journey. We have an AI tool that based on photographs you captured,
Okay.
we can indicate, do you have inflammation?
You don't even need a special mouth camera. Okay, so you're taking
You're taking those photos, that might trigger your awareness of, oh, I have high inflammation.
Okay.
Now, if I want to talk to a dentist, I can have a consult. Based on my health history, I might indicate that I have diabetes or whatever health concern. That would help guide the dentist in not only the education part, but, hey, let's get you into an office to address that inflammation and keep you healthier. Now we're starting to see, okay, good, we've got you into a dental care setting. And we also have this background information of the chronic condition or the systemic health concern that we're also trying to reveal a better outcome and improvement to.
How's the market shifting in terms of their acceptance of oral health, teledentistry? I know there's a pavilion here at Health about oral health. Is this an inflection point for innovation? What are you seeing?
Yeah, I think the pandemic really flipped a switch in terms of common sense policy changes and insurance plans reimbursing for virtual care. And now I think the market is still understanding, and like we had to, of actually being that care delivery, not waiting on a practice to always be the one, is to allow that bigger pool of patients and population to start having an easier path to access it.
Tell me more about that reimbursement shift, because that's so important.
Yeah. So just that evaluation. So when you go to the dentist for cleaning, you see the hygienist, he or she might provide a range of services that are preventive. They can't diagnose, so the dentist comes in and does the exam.
Yeah.
The exam portion is what we can do virtually, even without tactile evaluations, to help you understand what's the condition you're concerned about. So we do a problem-focused exam. That's reimbursed, and that's been long established now as acceptable. And what's great is then we know enough from that consultation to help a patient understand, even if people aren't fans of going in for unknown dental work. It's just a well-known thing. It's the second highest out-of-pocket expense in medical, and there's a lot of anxiety around it and a lot of unknowns that happen when you go in for a cleaning and what are they going to find. So what we want to do is have an educated patient who knows what might this be, what might be my concern, and if I go into an office, how much can I be expected to pay based on what we think it is. So we're really trying to kind of shepherd and concierge this patient in to be more educated and be more prepared, as opposed to, I'm going to avoid that appointment because I have no idea what they're going to find or do. So we found that's really good. And then doctors are happy, dentists are happy to have that patient who's coming in. One, it's valuable to have a new patient. Secondly, this patient comes in knowing what to expect. I might find a little bit different from based on their virtual consult, but they know that they need treatment, they're more open to it, and it doesn't feel as abrupt presentation of a case plan.
What do you think dentistry is going to look like 10 years from now?
I hope to see more Medicare coverage of preventive services. I think we're going to see a better integration across the entire care spectrum so that when patients, one, are more regularly acting and engaging with care, I would love to see greater provider footprints for Medicaid and kind of public health needs. That's still a crisis that hasn't fully been addressed. And I think you're starting to see kind of the evolution of dental insurance plans that might become more integrated with medical plans, that we know we can save a lot of money and improve outcomes on medical conditions if we give a patient at least 2 cleanings a year.
Yeah.
So how do we start bridging that gap? I think the technology is outstanding. There's a ton of AI being used in improving diagnosis and member engagement and speaking to patients more effectively. Yeah. But I would love to see that your physician, your pediatrician, your oncologist, your endocrinologist, that they make a priority of getting you connected to a dentist. We love it because scan a QR code or go to this URL, and now you're connected to a dentist, no matter where you might be, what setting you might be in.
Awesome. Well, we'll be watching to see if that happens, and I appreciate the way you've been pushing the market forward. So thanks for coming by.